to start off with the acknowledgements. This work has been done by lots of people and headed up by several vet students that have done summer research projects in our laboratory. And I'm really just sharing their work and presenting their work. And so I want to make sure that we give them credit for all of their efforts. And so first we have Sarah Lauterbach. We're going to be sharing some data with environmental contamination at weigh-ins. That was her project. Courtney Wright did the environmental inanimate object project. So we're going to have kind of 3 portions of the talk. And then the last portion was headed up by Allison Martin, who is also a veterinary student at The Ohio State University. And then we have a large program staff, and so we recruit an army for the summers within our group to go out to over 100 county fairs and complete these projects. And so we have a couple of us that stay back in the lab for year-round that are full-time. But for a majority, there are students that come along for the summer to go visit lots and lots of fairs. We do hours of driving for minutes of work, it seems. So I appreciate all their efforts spending their summers at fairs. So first of all, how many of you have been to a county fair, agricultural fair? Know what they are? Okay, so there are a lot of groups that we talk with, especially in the influenza world, that don't really know what a fair is, and so it takes a little more convincing that these things do exist. So agricultural fairs are a place where non-commercial swine are raised in a variety of scenarios, and so we know that some producers or some children that are exhibiting at these fairs purchased 1 or 2 club pigs at a sale. There's a lot of sales going on right now. This is the time of year to be buying your club pig, and so they may have 1 pig and a shed in the backyard, and that varies all the way up to club pig producers who may have sows on the farm and who may be raising lots and lots of litters in order to sell to these other youth. And so there's a lot of variety within the show pig industry. In addition to that, the pigs may have been shown multiple times. And so there are some families who are involved in jackpot circuits, and there are jackpot shows every weekend of the summer, essentially, and they go at the national level, they go through the entire year. So you can go to the south and show in the wintertime, and you come north to show in the summer. And so some of these pigs, we've done some surveys, and pigs have been shown, maybe 27 times. And so there's a lot of movement within the pig industry, the show pig industry. The swine that are at the fair provide a unique opportunity to teach the public about agriculture. It's extremely important that we're teaching the public about agriculture, and we're having these fairs where people can come and learn where their food comes from. However, most of these individuals have never been in contact with a pig. This might be their only chance to be in contact with a live animal. And so there's a unique interface between the animal and human here where diseases could be transferred. And at the fair or at exhibitions, pigs and people are commingle for a long period of time. So your family is at the fair for the week, and you may be living at the fair. You're likely living at the fair. You're eating at the fair. These youth become extremely attached to their animals. Oftentimes we have lots of pictures of kids sleeping with pigs, kids, hugging pigs, kissing pigs. And so they become extremely attached, and there's a lot of opportunity for that human-animal interface. And so we've been conducting surveillance in the pigs in Ohio since 2009 at county fairs, testing for influenza virus. It started as a response to the 2009 H1N1 pandemic. And you can see that our trend is that we have a slight upward trend, probably because we've been introducing other states into our study. But most previously, this year we collected samples from 104 different agricultural exhibitions in 5 different states. And we had a pretty high prevalence year. So we were at about 34% or so, 33% of all of the exhibitions that we visited within our study had pigs shedding flu virus. If you go to a fair that has a pig shedding flu virus, typically back in the early years, 75 to 100% of the pigs were probably shedding flu. Now, because of some measures that have been put into place, we do see a decrease in the prevalence within the pigs. And so just because the fair is positive, it may not be that 100% of the pigs are positive anymore. It may be more like 30% of the pigs are positive. So that's really important when you're thinking about virus being shed and humans having the ability to come in contact with those viruses. If fewer pigs are shedding virus, then there's fewer chances for those humans to be in contact with the virus. And so as we've been looking at the pigs at the fairs and A lot of effort has been put into place developing mitigation strategies and looking at risk for what makes a fair more risky, what kind of things can we do to prevent these kind of transmissions from occurring. And so several studies have come about in the last couple of summers trying to figure out how the virus is maintained within the show pig industry. And so in 2015, Sarah Lauterbach headed up a study, the detection of swine lineage influenza A virus on inanimate environmental surfaces during swine corralling at agriculture fairs. And essentially that's a fancy way of saying, is there flu at the weigh-in at a fair? And so when the pigs are brought to the fair, every place seems to do it differently, but a majority have a chute system, and you can kind of see it behind our samplers here. They have an area that pigs are funneled through to be weighed and tagged for the show purposes. And so the hypothesis was that the pigs that are coming to the fair shedding, we know that only about 1% of the pigs that are coming to the fair are shedding virus, that they are contaminating the area, and then the naive pigs or the negative pigs are coming through and picking it up on their nose, and thus that's how virus is perpetuated throughout this population. And so we have a couple of fairs that are introduced here. And so this first fair, we had 3 sampling locations, and I'm not sure about the pointer. Oh. So we have a hard stop here that's a plastic board. We have a second plastic board. We have a hard stop where they were being tagged. And then we also wipe these metal scale doors because those are the places that the pigs were really being stopped just to manage the flow of the pigs through the chute system and also for tagging purposes and for weighing. And so this is the scale. This is when they're in the scale, they're kind of moving around. They don't want to be in there. And so they're probably thrusting their head around and snot's flying. So those are the areas that we tested samples, and we were using cotton gauze. And so these are the results from that first fair. This is CT value, so we were using PCR to screen all of our samples. Every one of the blue dots is an individual pig. And so at these fairs, in this first study, we were testing pigs as they were every day of the fair, and we tested every pig individually so we could follow individual animals throughout the duration of the fair. And so you can see this cutoff line, this is a 40 CT value. Anything below is considered positive, anything above is negative. And so these triangles and squares and rectangles are the environmental samples at those 3 locations on that previous chart. And so you can see that we started at 8 a.m. and most of the pigs are negative. We got a couple blips down here. But for the majority, pigs are negative coming through that chute. And then we start to see some positives. And once we start to see some positives, you can see that every pig, so the sample that we were collecting was a nasal wipe. And so it's a sterile cotton gauze that we're wiping across the snout of the pig. We are not, before the pigs are being shown, we're not restraining them to do a nasal swab. It's a little less sensitive test. However, you get a lot more positive response from owners when you're not trying to snare their pig and put a swab in its nose. If they lose, then it's your fault. So we're just wiping their noses in this study. And so as we're wiping noses, you can see that we continue to have positives for long periods of time, a couple of hours, in fact. And once these pigs start coming up positive, our environmental locations that we're wiping are positive. And then the red dots mean that we were able to grow viable virus. And so it wasn't just a nucleic acid contamination, but we were able to grow live viable virus. And that's really important when we're thinking about the transmission perpetuating through the animal population at the fair. And so this is, again, kind of the same setup. This is a second fair. We had a wood board, a metal sidebar, and then the metal scale doors where it was a hard stop. And we see kind of the same thing, right? So we have some negatives going along for a while. They did take a lunch break, which seemed to help kind of clear up the contamination, having that lunch break there. But once we get some positive pigs, then our environmental surfaces become positive, and we start to be able to isolate viable virus off of those metal gates. And so just to give you an idea then of the pigs and how the virus spread within those fairs, these higher prevalence days are our time point 1, that's at our scale, And so likely because we were wiping the pigs' noses, this is a higher, we feel like this is a higher prevalence than what the pigs actually came in infected. It was that they were becoming, they were coming in contact with those contaminated environments. And because of our sampling methods, we were wiping the contamination back off their noses. So it appeared that they were positive. However, when you look at day 2, when they're back in their individual pens and we're wiping again, you can see the prevalence goes down quite a bit. And so this is probably likely the true prevalence of what those pigs were entering the fair infected. But you can see because because of the commingling that is occurring and potentially because of that corralling and the contamination that occurred within those waste chutes, the virus just spread like wildfire through that population. And at Fair 2, by the end of the fair, nearly 100% of the pigs there were positive. And so this is pretty striking evidence that something could be done to mitigate the transmission of viruses at the fair by either altering our scale procedure or by disinfection. But something probably could be done to mitigate virus transmission. So we noticed that that was in 2015 that we saw that this environmental contamination does exist within the scales. We were wiping different types of materials, plastics and metals, and so we were wondering about other items at the fair. And so how do viruses go from one fair to another or from a jackpot show to a fair? Because what we see is that most of the viruses are nearly identical. So it's not every individual fair has its own virus, but all the fairs have the same cluster, Florida cluster of H3 and 2. And so how does that happen? And so one thought is that potentially we're at the fair, and if you have a terminal show, your pig's not coming home, but all your tack is coming home. And so potentially we're just dragging virus home, and then we're leaving it in the trailer because we're going to a show in 4 days, and maybe that's taking it back to the exhibition and just perpetuating the viral transmission. And so this past year, Courtney had the objective to document the frequency of IAV contamination of portable fomites at agricultural fairs to try to identify mitigation strategies. So really we just want to have proof that we need to disinfect our show tack, which is one of the measures to minimize, one of the recommendations in the measures to minimize flu transmission at agricultural fairs document that has been put together and disseminated across lots of groups. And so for this study, we were going to collect samples from the pigs at fairs, and these are at individual fairs. We're not sampling every pig every day, but we're sampling 20 random pigs or 20 chosen pigs, selected pigs within the fair. We're doing it on the last day of the fair when, according to that last chart, we see that we're shedding the highest prevalence. And we're doing nasal swabs at that point, so we're restraining pigs and doing this now, the swabs. And so we have a little better test. So while we're doing that, then we were also going through the barn, and we were collecting samples from tack boxes, from sorting panels, waters, feeders, and chairs. So these bag chairs are extremely popular in swine exhibition. In fact, a lot of shows, that's what you win. If you're a good showman, you win a chair that has some embroidery on it. You win a tack box. We've seen groups that give out sorting panels, and so these items are not only in the barn because they're pertinent to showing your pig or to caring for the pig, but also because you're showing off that you won last weekend at the show. And so we went through it, and we were wiping these with the same cotton gauze that we're wiping pig snouts with. And you can see that we found we were sampling from items of different materials, and also items, some that had contact with pigs and some that did not have direct contact with pigs. And so we have a line here of PCR positive, so 22% of the items that we wiped that were in direct contact with pigs were PCR positive, and so they had nucleic acid from flu viruses. Again, we did this in the summer of 2015, and if you remember back to one of those beginning charts, 2015 was a really down year for us as far as the number of fairs that had pigs shedding flu. Okay, and so in a year that we didn't find much flu, we had 22% of the items that we were wiping in contact with pigs that were contaminated with influenza virus nucleic acid, and about 9% of the total number that were not in direct contact at the time we wiped them were also positive for nucleic acid. Of those, we were able to grow viable virus from some feeders, waters, and one tack box. And so the key findings, so if you put all those objects together, it was a total of 18.75% of the inanimate surfaces that we were able to detect IAV with PCR. There was more than one surface tested positive at 50% of the fairs that we visited, so it wasn't just one fair that had lots of things positive, but it was 50% of the fairs we visited, so in 2 different states. Within the positive fair, the frequency ranged from 5% to 90%, so you can see that at least one fair was probably had lots of pigs shedding virus. We probably we could look at that data and see the pig prevalence would be very high, with more pigs contaminating that environment. Viable influenza virus was recovered from 7 surfaces across 4 fairs, so 85% of the virus isolates came from plastic. And so just like we saw in the previous study where we were wiping those plastic sort boards and we were growing viable virus off those plastic sort boards in the chute, we were growing off of plastic as well. Also, rubber feed pan, I think, was the other culprit. And so what's really interesting about these viruses is that it wasn't just one strain that we were able to grow viable virus off of off the environment. However, we sequencing identified H1N1 pandemic 09 reassortant, a human-like H3N2, and a cluster 4A H3N2. And so, as you may or may not know, the human-like H3N2 and the cluster 4A H3N2 both caused human illness this year during the 2016 fair season. And so that's rather important that we're able to grow those viruses off of equipment that our youth and their families are probably throwing in the back of a truck or trailer and taking home with them or taking to the next show. And so this could potentially be the mechanism by which this virus is spreading to multiple show locations and potentially back home if they're taking pigs home. Not, a lot of shows are not terminal, and so they could be infecting their pen mates back home if they don't have good isolation when they get home. And then the viruses, because of sequencing, we can see that these viruses are identical to the viruses that we isolated from the pigs at these same fairs. And so it wasn't a case of a human coughing on the gate or on the, your sick kids, because I have kids and I know that they are germ factories, and so we are looking for reverse zoonosis as well. But these weren't identical to the pig viruses. All right, and so that leads us to the third study that was conducted this summer by Allison Martin. And she was interested more on the human health side of the interface at the fair. And so she was looking at the adoption of recommended hand hygiene practices to protect public health at agricultural fairs. And so a lot of recommendations have been put into place about hand washing, about fairs and shows, have been provided signage to let everyone that's going to the fair know that they should be washing their hands, know that there is a risk that you could become infected with a zoonotic disease when you're encountering animals at the fair, lists of the risk factors that make you more susceptible to these viruses. And so she really wanted to see if fairs were hanging up the signs they've been provided, if they're providing hand wash stations, and then are people using them. And so the first objective was to determine if the agricultural fairs had working hand wash stations. And when when I'm talking about hand wash stations, it could be either the portable hand wash station that's a sink with running water, paper towels, and soap. Some fairs have those. It also can just be as simple as the hand sanitizer pumps that are hanging on the wall. A lot of fairs in different states were provided those. And so when we go to fairs to sample pigs, and we've been doing this since 2013, when we first started to really see an uptick in human H3N2V cases, we've been documenting whether they have a hand sanitizer or a hand wash station, and then whether they're working or not. And so lots of fairs that you go to, you may come and pull the pump, but nothing comes out. And so we've been looking at that, and she found that I don't know if it's surprising or not, but 78% of the fairs that we have attended and that we recorded data for do have some sort of hand wash station. 87% of them are functional. So if they have them, they were likely working. The risk signage, so again, some states provided this for all of their fairs. 68% of them were hanging up. And so she was only looking at whether they were present or not. I know anecdotally that just because a sign is present doesn't mean it's going to be effective if it's hanging in the rafters and covered in dust. We also were at one fair we had a CDC site visit, and they were really glad to see that there was a CDC sign hanging in a pig barn. However, it was to notify people visiting the exhibition that if you have these risks, that you shouldn't be entering the pig barn, but it was on the inside and it was tucked behind, it was being held up by one of the posts. It was a post and beam board. So you could only see about half the sign anyway, and it was on the inside. So by the time you were able to see the sign, it was going to be too late anyway. If you were high risk, you were done. So, we probably should, as we're doing our educational efforts, we should be talking about, where we should be hanging our signs and the most effective way to use them. And then, again, it's been recommended that there are wash procedures accompanying the sanitation or the sanitizer stations or the hand washing stations. And about 43% of the fairs that we go to have these kind of signs present. And so the next step she wanted to look at is how many people are actually using them. And so we went to, at 20 of the fairs that we went to, we sat, we identified hand wash stations that were near swine barns. Sometimes you had to go to other barns to find them. Either way, we sat and we recorded for an hour how many people walked by the sanitation station and how many people actually used it. And we did this for an hour at 2 different locations within each fair. And we didn't count babies and strollers. We didn't count if it was load out day at the swine barn and everyone's carrying their tack back and forth from the barn. We didn't feel like that was a fair shake. And so we only counted really the fair goers and the people that were coming in, feeding their animal and leaving to go to the midway to ride rides. And so of the 20 fairs that we went to, we counted 2,021 people. And of those 2,000 people, 142 of them stopped to use the hand wash station. So about 7%. So 7% of the individuals who came by these stations that had the opportunity, they were leaving the animal barn, stopped and used the hand sanitizer or washed their hands. And so we also learned a lot about demographics, I guess, as we were thinking. We did not identify a single man that washed his hands. And so they were mostly mothers with their children. And so mom or grandma drug all 5 kids that they had at the fair with them that day, and they washed their hands. And so from a risk idea, the kids are at a higher risk, and so that's a good thing. The kids are getting their hands washed. 7% of them. But it was kind of interesting. We now our male samplers, we try to get after them about washing their hands a little more often. But so the third part of her study is that when we were washing those hand hygiene stations, then we also took a swab of them. And so she's got some pictures here. We had some roll packs. We were doing this in conjunction not only for influenza testing, but also for antimicrobial resistant bacteria testing, along with Dr. Whittam's group. And so we tested all of them. We did not detect influenza virus from any of these stations. However, 69.2% of them tested positive for an antimicrobial resistant bacteria. And so these found multiple phenotypes. So we have extended spectrum cephalosporin resistance and fluoroquinoline resistant bacteria, E. coli, salmonella, a large number of hosts. And I'm sure if you're interested in this, Dr. Whittam's group is putting this out. We could get you more information. But needless to say, there is contamination on these hand wash stations. No flu, but lots of other scary bugs. So that's something to consider. When you're touching them. We have not done any work to see if what's inside is killing what's on the outside. So that was the extent of her project. And so overall, we have some conclusions. Mitigation strategies such as like disinfecting gates and scales during animal corralling could decrease virus transmission. Inanimate objects could be perpetuating the spread of IAV or other microorganisms between exhibition. And then also fairs have followed the recommendations to provide risk signage and to provide hand hygiene stations. However, a majority of fair goers aren't using them. And so as we're going out and doing education, this is another area that we can be sharing information. So letting them know that they need to be using those stations when they're there, in addition to the disinfection that the youth swine exhibitors should be doing.